Good day, Mrs. Coker.
Good day, doctor.
How are you feeling now?
I'm getting better. Thank you.
Your husband told me that you don't use your drugs. And as a result of that, you now have no diseases.
Doctor, please, I'm an adult and I know what is good for my health.
I know you are an adult, but you should have at least take your drugs. And you are uneducated. Do you even know about the SDG?
Yes, I know their aim. So what does SDG has to do with this?
The SDG has a lot to do with it. So what do you know about the SDG?
Doctor, I only know the introduction and I don't really know much.
Are you aware they have 17 goals?
Yes.
That's great. So do you know about the SDG 3, good health and well-being?
No, doctor. Can you please tell me more about it?
Sure. The SDG Goal 3 aims to ensure healthy lives and promote well-being for all, at all ages. Health and well-being are important at every stage of one's life, starting from the beginning. This goal addresses all major health priorities: reproductive, maternal, newborn, child and adolescent health, communicable and non-communicable diseases, universal health coverage, and access for all to safe, effective, quality and affordable medicines and vaccines. SDG 3 aims to prevent needless suffering from preventable diseases and premature death by focusing on key targets that boost the health of a country's overall population. Regions with the highest burden of disease and neglected population groups and regions are priority areas. Goal 3 also calls for deeper investments in research and development, health financing and health risk reduction and management.
Wow, this is getting interested.
This goal has 13 targets and 28 indicators. Some of the targets are: by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. By 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. By 2030, end the epidemics of AIDS, tuberculosis, malaria and neglected tropical diseases and combat hepatitis, waterborne diseases and other communicable diseases. By 2030, ensure universal access to sexual and reproductive healthcare services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. Achieve universal health coverage, including financial risk protection, access to quality essential healthcare services and access to safe, effective, quality and affordable essential medicines and vaccines for all. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals in air, water and soil pollution and contamination. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. Provide access to affordable essential medicines and vaccines, in accordance with the Doha Declaration on the TRIPS Agreement in Public Health, which affirms the right of developing countries to use to the full the provisions in the agreement on trade-related aspects of intellectual property rights regarding flexibilities to protect public health, and, in particular, provide access to medicines for all. Substantially increase health financing and the recruitment, development, training and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. Universal health coverage. This target can be seen as an overarching one that supports the achievement of the other targets. It is derived from the Millennium Development Goals, the new targets and the means of implementation.
Thank you, doctor. But with all this, how can we achieve this goal?
To achieve this goal is not hard, Mrs. Coker. To achieve this goal, we will have to be reducing adolescent fertility and addressing the multiple factors underlying it are essential for improving sexual and reproductive health and the social and economic well-being of adolescents. Preventing births very early in a woman's life is an important measure to improve maternal health and reduce infant mortality. Let me stop here, Mrs. Coker. I have some other patient to attend to.
Okay, doctor.
When next do you have appointment with me?
On 5th next month.
Okay, I will be glad to have you here again. And please make sure you take your drugs.
Okay, doctor, I will try.
See you later, Mrs. Coker.